Welcome back to Search for a Cure. As coronavirus cases fall and vaccines roll out, governors and mayors are deciding what is safe and what is practical to get the economy up and running. Texas and Mississippi recently announcing the states are fully reopening businesses and rescinding mask mandates and the more radical steps to pull back coronavirus restrictions. Other conservative states are taking a different approach, with Alabama's governor extending the state's mask mandate through April 9th. Health officials and the president are cautioning the country against moving too fast. To discuss, let's bring in Dr. Aaron S. Weinberg, Director of Program Development at Carbon Health, who led the development of the COVID Positive Care Program. Dr. Weinberg, welcome to the show. I have to ask, there's so much debate right now. Do you think it's too soon to reopen in the way that Texas and Mississippi are?
Hi, Hannah. It's good to see you again. Thanks for having me back on your show. I absolutely do. And the reason I say that is, you know, we've now gotten to a point where we're catching up on our vaccines, and we're starting to roll it out. We're starting to scale it up, and we have the real opportunity to get this virus under control. However, if we open up things too quickly, if we do an all-at-one approach and we don't take a methodical, systematic way of doing this, using data, using science, using contact tracing to see what the effects of these openings are, we could very easily slip back into another spike. Our country's been through so much with over 500,000 deaths and 28 million cases. I would hate for us to have to go through another serious spike again. And we know that it certainly could happen if we rush this process.
Dr. Weinberg, so I live in Connecticut. Yesterday they announced they're lifting all capacity limits on restaurants, houses of worship, gyms will reopen, but the mask mandate, it remains. So how concerning is it to maybe lift a mandate or not at this point, considering the majority of the population does not have a vaccine yet? Obviously, Connecticut and Alabama even are handling it a lot different than Texas and Mississippi, but the direction is still the same.
It's incredibly concerning. We know that masks work, and I think that masks should be one of the last things that are lifted. It's okay to slowly open up things, open up businesses, as long as we're monitoring the situation on the ground. But masks should really be the final step in this whole process. Masks save lives. You know, I'm also a critical care doctor, and in the hospital, we know that masks work. Our healthcare providers, our frontline workers, nurses are going into rooms with patients that have active COVID, and they themselves are not getting it. And the only reason they're not is because they're wearing the proper protection. They're wearing masks. So it really bothers me greatly as a physician, a healthcare provider, that this has become a political issue. You know, viruses don't belong to political parties. They don't stay within blue states or red states. And really, we know it's an easy, cost-effective way of keeping people from getting the virus. And it really should be a clear message from the top down, from the federal government to the state governments to the local governments and communities. There really, I don't think, should be any debate on this issue.
I do want to talk to you about Texas. There's been an average of 7,200 coronavirus cases per day just in the last week. That is an increase of 6% from just 2 weeks ago. Do you see this number increasing even more as these restrictions are lifted?
They very well could. You know, what we look at in terms of the ability for this virus to spread is a few things. One, it depends what percentage of patients or people on the ground have had the virus already and have some degree of immunity. It also depends on the percentage of patients that have been vaccinated. And you know, last that I checked, I believe Texas was 48th in the country in terms of per capita vaccination. So they have a long way to go in terms of getting their population vaccinated and protected. And the other thing we factor in too is these mutations that are popping up. We've seen a number of them. Viruses mutate. It's a normal process as people spread the virus. The replication of the virus causes errors in the DNA or the RNA of the virus, and that leads to some of these mutations. And some mutations can lead to more infectious and contagious spread. So, you know, one reason for wearing masks and really practicing the necessary precautions that we've been doing is to cut down the spread, because the more you can cut down on spread, the less chance the virus has to mutate and form a more virulent strain.
I do want to ask you another question about the variants, because where I am in New York City, movie theaters are opening today with limited capacity. This, of course, as the New York variant is spreading. How much of a concern is this variant as the city begins slowly rolling back their restrictions?
It is a concern. We know that some of these variants, whether it's the British variant or or some of these variants that have popped up in New York and California, they seem to be more infectious, meaning that they can be spread a lot easier from person to person. And it doesn't necessarily mean that they're more deadly, although the more chances you have to spread a virus and the more people that catch that virus, obviously the death numbers can go up on a population scale. However, the concern amongst us physicians and scientists is that if we keep having these mutations, then it could lead to a much deadlier strain of the virus, and that would be catastrophic at this point for our country.
Dr. Weinberg, I have only 30 seconds left with you, but I really want to get this question in. As more states lift their restrictions or roll them back, do you think this is just coming down to a matter of COVID fatigue?
I think there is fatigue. I think there's fatigue across the board, from healthcare providers, frontline workers, to the general population. We're all tired of this. However, the best way to get beyond this is to practice the safe practices that we've talked about: mask wearing, social distancing, taking those necessary precautions, getting vaccinated as soon as you can with whatever vaccine you have available. They're all very good. They're all very efficacious and safe. I like to always use a sports analogy. We're kind of in the third quarter, approaching the fourth quarter right now, and now's not the time. Even though we may be ahead, even though we may be getting small wins such as the vaccines, now's not the time to stop playing defense. We need to still take the necessary precautions.
I love that analogy, and we love having you on the show. Dr. Aaron S. Weinberg, Director of Program Development and Carbon Health, thank you again for being on, sir.